for our first presentation, which is giving the perspective of WHO Integrated Health Information System and how to encourage it. We have three key messages to share with you first. And these are that integrated health information systems are more reliable and essential for better healthcare delivery and better health outcomes. Well-functioning HIS depends on harmonized and interoperable data elements. And the word interoperable is very important if you really want all these systems to integrate together. Multi-sectoral approach is key to strengthen integrated health information system at national and sub-national level. So when we look at these three key messages, I mean, the first one tells us about the importance of having an integrated health information system. The second one tells us what is it we should do to make them integrated. And the third one is one of the key punchlines to get the right ecosystem in place. See, we can put all the technology in the world to make our systems work, but they're not going to work until we have the right ecosystem in place, until we have the right partnerships working, until we have the right environment working for the systems to work. So that's what the third punchline is about. I'll be sharing with you the 10 critical success factors for integrated health information systems. Now, there are lots of things which we can do to have these integrated systems, action plans in place, but what are the 10 most important things we need to do? And these are the guiding principles which one can use to develop work plans, national master plans for coming up with integrated health information systems. So the first one we have there is, now I'll go through each of these critical success factors one by one, but in a very quick snapshot, the green words which are there, they are the key words. We need to have standards, integrated data repository, we need to combine data from various sources, data warehousing can help you there, partner coordination is a must, alignment in what form, stakeholders as well as strategies is necessary, interoperability, most important, systems approach, data standardization, multi-sectoral engagement, and common monitoring and evaluation frameworks. So these are basically the 10 critical success factors, and if these 10 guiding principles have been incorporated while doing our plans for integrated health information system, the success is quite well guaranteed. The first one is on adoption of standards. Now, when we talk about integrated health information system, it's a really complex landscape. And if we are looking at this complex landscape without a standardized approach, without what we call as the silver bullets or the gold standards, it would not lead to the right final goal we are looking at. So, for adoption of standards, we have two standards promoted by WHO. They complement each other basically. The first one is the Framework and Standards for Country Health Information System by HMN. HMN stands for the Health Matrix Network. So there is a thick publication which can be shared with all of you, although if you are interested in it, but it's also on the HMN website. If you go to the HMN website and search for this, you can find it there. And the second edition of it was in June 2008. You can use that edition, and that gives you the standard for country health information system. And we also have a 10-point regional strategy, which is a document like this, which was approved by WHO's Regional Committee in September 2010. And regional committees are governing body. Indonesia is a member of that regional committee. So adoption of this regional strategy is mandated by all the countries of the region, including Indonesia, and we are supposed to report back in 2015 to the regional committee how did we go and adopt this strategy. Now, a combination of the two actually helps us also achieve a third goal, which was set in by the Commission on Information and Accountability. How many are aware of the Commission on Information and Accountability? No, okay. The UN Secretary General has come up with a strategy which is called the Global Strategy for Women and Child Health, and that is to accelerate the achievement of MDG Goal 4 and 5. Are we aware of MDG goals? Yay! Right. So it was noted that the achievement of MDG goal 4 and 5 was quite stunted in many of the developing countries and the least developed countries. So this strategy was rolled out or adopted by the UN Secretary General in September 2010, and following to make sure that the strategy gets implemented and monitored and oversight and accountability framework is around that. Secretary General also asked our Director General of WHO to formulate a commission, and this commission had very high-level commissioners, generally the ministers of health, presidents, prime ministers, Prime Minister of Tanzania and Canada, they were the chairs of the commission. So, I mean, it's a very high-level commission which came up with 10 recommendations. And if we go ahead implementing these 2 standards we're talking about, to a great extent, we are also walking in the right direction to implement those 10 recommendations. The 3 recommendations, the top 3 were for better use of information, and that had, the first one was on strengthening the vital registration systems. The second one was on having more integrated health information systems with data available extracted from all sources, and also having disaggregated data by various considerations, equity, gender, etc. And the third recommendation was on the use of ICT. So when we talk about health information system, in parallel we are talking about developing ICT also. So these were the 3 for on better use of information. So as we go implementing all these standards, we are eventually, the third thing we are automatically implementing is also the Commission's recommendations. So this HMN framework is an approach to build modern interoperable health information system, and that provides a structure for defining the country-specific needs for health information strengthening, offers an HIS strengthening approach based from situation analysis to plans to forecasting financial needs for implementing these HIS systems. It gives you kind of a comprehensive framework which helps you produce your strategic HIS plans, and it tells you what should be the ingredients of these strategic HIS plans. Over 80 countries have adopted the HMN framework to various levels of its implementation. 62 countries have conducted the HIS assessment, and Indonesia was one of the countries which actually conducted this HIS assessment using the HMN framework. When you see Indonesia marked as red on the graph out there. No, believe me or not, that's true. So that was the first success factor. The second one now we'll talk about is to have a key functional block of integrated HIS, that is creating an integrated data repository. So what you see here is all the functional blocks of an integrated HIS. What we are trying to say here is that in your HIS you should have an integrated data repository, and that should pull out data from all data sources. Shouldn't be leaving out of data any data. So if you leave out a data source, what happens? Your data is not complete. And when you're pulling out or extracting this data, it has to be consistent and comparable. Because every system, if you have all these silo systems, they have different definitions of data. So they have to be comparable and compatible. And one advantage of also going with this integrated data repository is that you can see consistencies across data, you can make best use of the synergies and complementarity of data. So one element of data can complement the other element of data. This integrated data repository should help you collect, manage, and distribute data across the country. In other words, it should be accessible also at multiple locations. So what you see here is, the first block there is the data sources. From there, the data gets extracted, gets into the integrated data repository. You should be able to see analytical reports across the data sources from it, which is the dashboard, the reports, the queries, etc. And the users of this could be across different ministries, international organizations from district level to the national level, health officers, and also civil society will be the user. So it's kind of, we're looking at, when you say the user base, it's not one vertical slice of users. We're looking at a full gamut of users there. When you talk about data sources, again, you're looking at a full gamut of data sources there. So that's what's meant by integration. It's combining, looking at a big picture, a full umbrella approach there. And of course, to do this, you would need solid policies, you would need good resources, and you need processes. It doesn't happen overnight. It's just, we're laying down, that's why we say a roadmap, we're laying down a path on which we can start walking, and one day we're going to reach that right destination. But it's important to walk in the right direction. The third critical success factor we have there is a well-functioning HIS combines data from various sources, be it facilities data, administrative sources of data, or surveys. Now, generally when we look at data sources, we can categorize into two major categories. The first category here is the population-based data, where your data could be extracted out of each individual in the population, or it could be from a sample of population. So when you look at census and civil registrations, these are meant to be for the entire population, each individual. And when you talk about population surveys or demographic household surveys, they are usually random samples or different kind of sampling techniques they use. So from one small sample of population data is taken and then it's kind of extrapolated. The other set of data is the institutional-based data, which comes from the operations of health and other institutes. So this is coming only from those who are visiting these institutes, so those who are using these services. So this could include individual records like the case histories of individuals. It could include service records like how many drugs were distributed, or even mortality and morbidity data coming from the institutions. And then the third category is the resource records, which could be financial, logistics, human resources, that kind of data. So when we are looking at an integrated health information system, we should look at the data coming from all these sources, not leaving out any source. And there are many producers and many consumers of this health information system data. It's not just always the health ministry. That is finance ministry, education, labor, Ministry of Justice, private sector, insurance providers, and a lot of development partners also. So there is again a large gamut of stakeholders we are talking about here. The fourth critical success factor we have there is linking and harmonizing different subsystems among programs through data warehousing. Now, if we see the situation as of today, in most countries, we don't have one big mammoth integrated health information system. What we have in reality is silos of information systems. And if we say we're going to ramp up all these silos of information systems and start developing a fresh, new, integrated health information system, that's quite a long way to go. I mean, the countries which are coming up new with health information system, they are developing these integrated health information systems from the scratch. But those countries who've been having these electronic health information systems, the computerized health information systems for a long time, they actually have silos of health information systems. Now, where do we make a start then? The good start is create a layer on top of all these silos, which is called data warehouse. So that layer is going to collect data from all these silos, and it's going to give you online analytical processing capability on this data, where you can analytically understand the data and you can produce useful information for effective decision making. And that's what we're trying to promote here. Harmonize the systems you have for now, create a data warehouse, and with that data warehouse, you would see the outer picture of an integrated system. And in due course of time, you can keep on developing an integrated system. I think some of this work is already going on in Indonesia. I'll talk about it a little later. The fifth critical success factors, and which is one of the ecosystems, as I said, like we talk about just technology, that's not going to be helpful. It's important to have partner coordination. Now what's happening is there are lots of fragmented needs, a lot of increased needs are coming from global and country partners. Now, since all of this is fragmented, what happens is one donor is asking for 25 indicators, another is asking for another 30 indicators, and if you add on all this, you come up with a list of monitoring 200 plus indicators. And that becomes quite a tedious thing to do on a periodic basis at times. So if we harmonize or have better partner coordination, we can do much better in coming up a more useful list of data, more useful requirements to be satisfied. So usually what happens is, depending on who's providing the financial support, you would see a system for Gates, a system for PEPFAR, a system for World Bank, and donor by donor there is a system there. Even you see a lot of verticalities happening disease-based. You have a system for malaria, you have a system for HIV/AIDS, and so on. So all these vertical systems is what we are all standalone systems. They are not talking to each other. They are not sharing data across each other. A lot of duplication of data collection happens across it. So a malaria program is sending a survey form to a community center for collecting data. Next day you will have the HIV people sending something out and so on. And people say, oh my God, I'm spending so much of data again and again. So as we go about having more stronger country policy on HIS partnership among countries, among donors, among agencies, among stakeholders, such kind of duplication can be avoided. So that's part of the partner coordination. The sixth success factor is alignment of HIS stakeholders and alignment of HIS strategies. Now, as I said, there are lots of stakeholders. The governments are there, the hospitals are there, the private sector is there, communities, SMEs, technical experts, entrepreneurships, lots of them are there, and they have different stake. You have pharmaceutical companies who have a stake in the whole of health information also. So in each one of these, if they all go in their very direction without any alignment, there will be more resources being pumped into health information system with less amount of output getting out. On the strategy side also, you would even see at the national level, you would see an HIS strategy existing separately. You have an mHealth strategy existing separately. You have an HMIS strategy, which is more with all the management systems also separate. You have the electronic medical records strategy, EMR strategy separate. You have ICT strategy separate. You have HR capacity development strategy separate. And all of them do not have coherence with each other. So what happens? You talk about integrations of systems. So unless these strategies integrate, your systems will never get integrated because each would go in their own direction. So it's very important to have alignment of strategy also. The seventh success factor is a very, very important one. I didn't want to put it at first because it's a little technical and a little harder to understand. So I put it as 7 for the ease of understanding, but otherwise I would put it on the top. And that is interoperability. See, as I said, as of now, we have silo systems. We have fragmented systems. We don't have one system. So if we have silo system, it's very important all these systems should exchange data with each other. They should talk to each other. And how should they talk to each other? While preserving the meaning of the data and while making that data understand consistently across each system. And that's what is interoperability. I put a big definition on the right hand side which you can read in your free time. That's what interoperability is, making silo systems talk to each other with coherence of information. Like for example, one system might be recording adult age as 18, another system might be recording adult age as 14. So if you start comparing numbers, you're actually talking about a completely different population data set there. So how would you make these consistencies across? You need certain things to make these consistencies across. How do we do that? How do we make systems interoperable? So it's very important to have or improve interoperability of HIS, and that can be done with, again, another set of standards. So we need to identify appropriate standards to use. We need to implement a health information exchange standard to promote systems interoperability. There are certain WHO standards I'll be talking about, and these are IMR and SDMXHD. IMR stands for Indicator and Measurement Registry, and SDMXHD stands for Statistical Data and Metadata Exchange for Health Domain. I was told that yesterday there was a presentation on Connectatum, and Connectatum is what uses SDMXHD. So that's a standard which is already in use in Indonesia for what? For interoperability and making these different systems talk. When we talk about different systems, it could be even one system operating at different levels of the administrative boundaries in the country, from district to provincial to national level. Or it could be two different systems also. But it basically means across boundaries you are going, across boundaries of your health issues, across boundaries of your geography, whatever. But making systems talk across boundaries. What are interoperability challenges? See, the fragmented efforts to develop HIS in absence of adequate governance, standards, and national plan results in HIS that cannot exchange data across various modules. And even if they would exchange data, that data exchange would be meaningless because different things would mean different to different systems. So these systems then are mainly standalone and disintegrated, lacking unified coding schemes, following different or no standards, which result in total lack of interoperability between them. Without interoperability, the data can be inconsistent and data analysis would not produce intelligence required for appropriate decision making, because you're not comparing apples with apples. You start comparing an apple with an orange and make decisions on that, that would make no sense. So where all do we need interoperability? I mean, we require it across 4 pillars of HIS. And what are these 4 pillars? The first one is health information platforms, and there you have 3 entities: national, provincial, and regional. So all these 3 levels should have interoperability. Otherwise, whatever your national level accumulation of data happens, that would not be consistent with what's coming from the bottom up. The second is health domains. You have public health, you have medical services, you have medical security related services, general health management, etc. So 5 domains are there. Across those you would need interoperability. The third one is across various health databases. You have the HIS system, you have the hospital management information systems. Across them also you need interoperability. Because there are certain notifiable diseases which we get out of the hospital management information systems. And why should one rekey in everything into a health information system? The two can be made to talk, you get your systems working seamless for long term. And then of course you need a dedicated health network. I've added virtual private network to it for the reason that it's even better to have one network across all government agencies and create a virtual private network for, say, health separate, education separate, running on the same physical layer of networking. So this 3-5-2-1 approach is actually the approach which China is following for their integrated health information system, since we found it quite interesting, if I like sharing it with you too. So, what do you mean by health information exchange? It's basically the capability to electronically move clinical information among separate HIS while maintaining the meaning of the information being exchanged. And how do you do that? For this, we do need certain standards for the developers and users, and these are like ISO 2115 Technical Committee on Health Informatics standard. Then there is HIS-KR standard. there is SKMT standards, all these standards are there. Now, how does the SDMX and IMR fit into the entire interoperability landscape? You see, the IMR defines the content, and SDMX HD is the data exchange format. So the standardization of content happens through IMR, and the data exchange, the technological data exchange standards happens through SDMX HD. So two kind of go hand in hand to some extent. What is IMR? It gives you definition, management, and harmonization of indicators, definitions by WHO, countries, and partners. So it's coming up with one standard, harmonized list of indicators which form an international standard, could be used in computerized systems, and forms a global definition. The other two examples of standards are HL7 and SDMX. So what's the difference between the two? HL7 is a data exchange or a messaging standard primarily for patient-based transactional systems, which normally use e-health systems, EMRs, laboratory systems, all of that. And SDMX HD contains a data structure definition which defines concepts, definitions, attributes, port lists, etc., and other artifacts for defining the structure of the data. So in other words, if you're using in your HIS and in your MLE framework, monitoring and evaluation framework, to strengthen seamless flow of information between district, national level, you would be using the SDMX HD there. And if you're developing an e-health system, maybe you're doing teleradiology, you're doing a couple of other things. Maybe for teleradiology, you'll be using DICOM. And then you have other systems like cardiology, telecardiology, and other systems, you will be using HL7 there. Now from this we move to the 8th critical success factor, that is systems approach to HIS architecture is necessary. See, even if we go, when we are developing, even if we go piece by piece, module by module, it's okay. But when we are thinking, we should think with a mixed systems approach. So at the planning stage, it's always important to have an end-to-end systems approach. And what that would be at the level 3, we will be talking about health information exchanges, where your SDMX and other interoperability standards would come, your IT infrastructure would come, your data standards would come. At level 2, you have application level stuff, which includes your EMR, the electronic medical record system, your hospital information system, your HMRs, etc. And at level 1, we'll be talking about business level requirements. What is this information meant for the users? So in user requirements for information and how this information will be used by the different end stakeholders. The 9th critical success factor is data collection techniques need to be integrated for data standardization. I mean, there could be several techniques for data collection. You could have a scanned form, you could have a web-based form, you could have it from your mobile phone, or you could have a PDA for it. I mean, irrespective of what you follow, there has to be a systematic thinking process there, what's more useful where, and what is the purpose of it, and making best use of all these technologies, rather than just tied up to one paper forms. You can have different ways of data collecting. I mean, it might sound like that and say, oh, data collection, that should be simple, but it's really not simple. So challenges of data acquisition and management from disparate sources, it cannot be underestimated. So a lot of thinking has to go into it. If you really want more turnaround of your data, if you don't put right thinking on what's going to happen, the data response is going to drop drastically. If you want good data response, you have to be creative in data collection techniques. The last critical success factor is multi-sectoral engagement. You know, it's not just the ministries of health, it's so many other ministries, including now the Ministry of ICT being an equal partner into all the health information system products. Donors are there are other development partners, so all of them have to work in a coordinated manner in order to have sustainable health information system, which is country-owned. So with the country ownership in place, should be owned by country, however, everybody has to work together in a very consistent landscape. There is need of multi-sectoral engagement across the entire HIS dependency cycle if you want HIS data used for better health outcome. And this slide gives you the entire cycle. I'm not going to read through it. We'll move to the next one. I think I'm almost done in my time. The last one is Common National Health Sector Monitoring and Evaluation Framework. If you recall, I just mentioned a while ago that from different donors we go and collect different set of indicators, and if you combine all these indicators, you end up with 200 plus indicators to be collected on a periodic basis. So there's another initiative that WHO is undertaking, which is to work together with all the donors and come up with a common monitoring and evaluation framework. It's going to be one framework which every donor is going to use. And it's going to have your input and process indicators, output indicators, outcome indicators, and impact indicators. So what kind of indicators can be collected? Across 40 indicators, we have created a framework which can be modified from country to country, but it involves a lot of donor engagement so that the reports which you produce out of this MNE framework are accepted by donors, and each donor doesn't come and ask for their own reports. And this initiative has already been taken place in 7 countries across the globe. In our region, we started with, in Southeast Asia region of WHO, we started with Nepal. The next country on the list is Bangladesh, and we would be even happy if Indonesia wants to be the 3rd country on our list. So what would an integrated HIS look like? That's what it's going to look like. It's everything. It's one common framework across all health programs, across all applications which you want, across all functional services you want, across all health modules. And it's going to serve all our core requirements. You may have data warehousing in that, because for now you don't have one single managed system. And I don't even say that you need to have one single managed system. As far as you're able to integrate these silos to have them interoperable, that's good enough to achieve our goal. And at the base of it, you have an integrated infrastructure for ICT, which is important. So that's what your integrated HIS will look like. And all of this, there is a sense of urgency around that. Why there is a sense of urgency? Because with the fragmented systems, the healthcare delivery will suffer. It is suffering. So as we go with more integrated systems, it's going to give us better health outcomes. And here are back to our 3 key messages. Thank you.